Let's go. She needs help. I'm having a heart attack. Oh, somebody help me. Help me. I need it. Oh, baby, go get somebody.
Hi, my name's Ashton. I'm going to be the nurse today. I heard you're having some chest pain.
Yes.
Can you tell me your name and date of birth?
My name is George Gutierrez. My date of birth is 8/24/75.
Okay, can I see your bracelet? We're just going to check and make sure. Okay, perfect. When did your chest pain start today?
Early in the morning.
Is there anything that's making it worse?
Breathing.
Okay, is it radiating anywhere?
Down my left chest. Left arm.
Oh, okay.
Yeah.
Okay.
Down my left arm.
What's the quality? Is it like a 0 out of 10? What's the worst pain?
20.
10 being the worst. Oh.
It's a 20.
20, okay.
Yes.
And you were just sleeping when this started?
I was waiting for my honey to come home and give me some sugar.
Okay. Okay, perfect. Well, since you're having chest pain, we're going to go ahead and get an EKG done immediately because that's what's best for determining whether you're having a heart attack. So I'm going to check your vitals real quick. Okay, so your heart rate's good right now, and your oxygen is a little low, so we do this thing called MONA, and it's morphine, oxygen, nitro, and aspirin.
Higher than a kite.
Did you take anything before you came in today?
Yes.
What did you take?
I took my nitro.
How much?
I took 2 of them.
2? Okay.
They're
When was your last dose?
about 4 to 5.
Okay, and it's 5:30 now, so we'll be able to give you some more nitro, okay, to hopefully help with the chest pain. Did it go away at all when you took the nitro?
No, I'm sitting here sweating like a hog in a smoker.
Okay.
Feeling a little sick.
Okay. Well, because your oxygen's low, we'll get you on some oxygen too. I'll get some orders from the provider, all right? Your blood pressure is also pretty high, so we're going to let him know about that, okay? All right, thank you. I'll be right back. Do a quick assessment for a few things because you're coming in representing a cardiac patient. Okay, so I'm going to listen to your lung sounds first, all right? Listening, take a deep breath for me. Deep breath. Okay, so I do hear a little bit of crackles in your lungs, which could be indicative of some fluid buildup in your lungs. So we'll let the provider know. We're just going to check for any lower extremity edema and your cap refill. Let me see your fingers real quick. Good. We want this less than 3 seconds. It's less than 3 seconds. Hi. Okay, so one of my friends from the lab is going to come in and do the EKG because we need to get it done pretty quick. And then right after, I'm going to draw some troponin levels to help differentiate between a heart attack or not.
You think I'm having a heart attack?
My name is Sammy.
Hi.
I'm so sorry that you're feeling so bad, but we're going to get to the bottom of it, okay?
Okay.
All right, so I'm going to hook you up to this EKG, okay? There's going to be 12 leads.
Okay.
I'm going in your shirt.
Oh, you take my shirt off?
All right.
Okay, and what are you looking for on there?
This is just going to show us the heart rhythm. All right, and it is done in printing. Awesome. So this is going to be sent to the nurse's station. I'm going to grab it and give it to the healthcare provider, and then he'll let your nurse know the results, okay?
Okay.
Okay, we're going to go ahead and keep
Filling
it
out the whiteboard for you just so you can stay updated on your care today.
Okay.
So you're in room 3. Your name's George, correct?
Yes.
Okay. And I will be your nurse. And we're going to be on a cardiac diet. And we'll have you up in the chair because of your breathing difficulties. And currently, I'm going to have you at a high fall risk just in case you get dizzy or have any loss of consciousness. And hopefully, we can get you discharged sooner than later so that you can get back home to your family.
So much sugar.
Yes, and can you remind me what your pain scale was on a scale of
20.
0 to 10? 20.
It was 20.
Okay. Okay. All right, do you have any questions?
Just get me breathing right.
Okay,
Get
perfect.
me right.
All right, so they did the EKG EKG, right?
Yes.
How did that go?
I don't know.
Okay.
I have no idea.
There wasn't any pain during the procedure?
There's pain all the time.
Okay. Well, the good news is there was no ST elevation on your EKG, which is a good sign.
I don't know what
So-
What does that mean?
The ST elevation indicates that there is a active myocardial infarction, so that's a heart attack, and you could be having some sort of heart attack, but it's not an active STEMI. It could be a non-STEMI, so we're going to check your troponin levels, which is a little blood test. We're going to get some blood work from your arm, and the markers will tell us whether it's a heart attack or not.
I
Okay?
don't like needles.
I'm sorry. We'll do our best to keep you as comfortable as possible, okay? Okay. All right, ma'am. So I'm going to start the line so that we can get your morphine administered for your pain. And then we also have a sublingual nitro tablet, which helps with the pain. And we can give you one every 5 minutes for up to 15 minutes, okay?
I already took 2 this morning.
Okay. So we'll give you one more for now, and then I'll talk with the provider to see what he has ordered for next.
Okay.
Okay, and I'm also gonna put you on some oxygen because your oxygen is decently low, okay? So we're gonna just put a little nasal cannula on. Okay, hopefully this will help with your
I can
breathing.
breathe a little bit better.
Okay, good. So I'm gonna get my supplies. For my IV, can I see this arm? We're just gonna look at it. Okay, so we'll probably start your line right here to draw the blood and give your medication, okay? So, all right, I'm starting the IV. I'm sorry. All right. Okay, good. So I got your blood work.
Pretty good with that needle.
Thank you. Yeah, you did awesome. We're gonna send this off to the lab and see what they say, okay? And the provider will come in and let you know.
Okay.
And then we're also gonna administer your morphine, all right? And hopefully this will help with your chest pain. And we're gonna come back in and assess you here shortly, and just let us know if it works for you,
It's gonna
okay?
make me feel good. Too,
Yes.
though, right?
Yeah. Okay, so we got your lab work back, and it looks like your troponin is slightly elevated, so that may indicate that you could have had a heart attack earlier in the day.
Felt like it?
Yeah.
Felt like it.
Did the medicine help at all with your
Oh,
chest
man,
pain?
I'm flying.
Okay,
Thank you,
good.
yes.
All right, well, the provider's going to go ahead and admit you to a cardiac floor just to monitor you for the next few days and just to make
Can't go
sure.
home.
Well, we just want to make sure everything's okay, because if you do have another heart attack, the provider will already be here to help get everything under control so you don't have more damage to your heart, okay?
Can I come, honey?
Yes.
Okay.
And you can let them know that in about 72 hours, they may have you do an outpatient stress test just to check your heart and make sure everything's working good now.
Okay.
Okay, do you have any
Yeah,
questions?
what's gonna happen next?
Well,
When I go home.
when you go home, we're gonna make sure that you know how to detect the chest pain that's going on. You can come in sooner and not wait to hopefully prevent your symptoms from worsening. Okay?
Okay.
All right. Do you have any other questions?
No, baby, you're gonna have to call your mama. Okay.
Do you have any recommendations for when he gets home?
Yeah, so the doctor recommends a low sodium diet and a heart healthy diet. So you definitely want to get your fruits and vegetables in.
Okay.
And then no smoking. That's definitely not good.
Might as well kill me now.
And
I
It'll definitely, you'll see positive response immediately as soon as you
I
quit
can try to
smoking.
cut down a little bit, I guess. I can
Yeah.
be around for my kids.
You could do
See
it.
you growed up and maybe graduate.
Yes,
Mhm.
that would be really good.
Mhm.
And they also recommend limiting the strenuous activity because it can be really hard on your heart, especially if you did just experience a heart attack.
Cover your ears, honey. Cover your ears. That means I can't get no sugar from my baby.
You can, you
No
just
sex.
have to be careful.
Oh, okay,
Yes,
okay.
because if you get chest pain, you definitely want to come in immediately and don't wait, okay?
Okay.
Okay. Okay, so we're taking you to the cardiac floor where they're going to monitor you, and then
Okay.
you'll follow up an outpatient in about 72 hours for the stress
Okay.
test, okay?
Okay.
All right, hope you get to feeling better.
Me too, thank you.
Thanks for watching. And don't forget, if they have an ST elevation, they are probably having a heart attack.